Before I begin, I'd just like to say thank you, of course, to Arthaland for inviting me to speak to you guys today and to all our participants. Of course, I have a lot of friends from Arthaland, a family member. Thank you again for giving me this opportunity for giving you guys a little bit of insight on what we've experienced here in the province of Isabela. My personal experiences, the experience of some of our mayors, the provincial government, and also to give us an insight away from what we typically hear in the news about, because mainly what we hear about in the news is focused on or centered around Metro Manila and the experiences they have there. So we also want to show you what our experiences and challenges here in the province of Isabela and how we've come to overcome these challenges, how we face these challenges in the fight against COVID-19. So again, good afternoon to everyone. Thank you to all our attendees. I hope all of you guys are well and healthy and safe. And yeah, so I'll begin my short presentation. Let me just share this. Okay. All right. So firstly, I'd like to again make the assumption that most, if not all of our participants right now are maybe coming from Metro Manila or other big cities. Again, I'd like to describe how our experiences here in the province and other rural provinces for that matter. And so I'd like to go back into what we've experienced prior to the community quarantine. You know, honestly, I believe like most people, just like myself, a few days before the President Duterte announced that NCR was going to be put on a community quarantine, most people didn't think that this was going to be implemented. Most thought that the COVID-19 was just like a seasonal disease or infection or the seasonal flu. Some even compared it to the seasonal flu prior to us implementing a community quarantine. But then 2 days before the community quarantine, I remember I was flying back to the province and the president announced that the NCR was going to be put in community quarantine. That's when you really realize that how the gravity of the situation and how much of an impact this COVID-19 will have into our daily lives, into our society, and of course to our economy, and of course the health risks that we all face. So let's go back to March 15th in the community quarantine. And a few days after, of course, we've had the whole island of Luzon be put on extreme community quarantine. Again, to all our participants, I'd just like to say that let's try to keep this, light and conversational. If you guys have any questions or anything you need to be, if anything you want me to clarify along the way, please feel free to do so, to stop me, just so we're on the right, or we're on the same page. All right, so with the announcement of the enhanced community quarantine, of course, this emanates many challenges for the country, many of which are the ones I've listed here in front of you guys. So some of our biggest challenges up to date is how do we bring people home who are stranded when we've implemented this lockdown? How do we sustain food rations for every family? How do we protect our home? When I mean home in this sense, I mean our household, and also for our local leaders, how do we protect our localities, our municipalities, our cities, our provinces? Next is how do we provide income for the families in our localities? How do we protect our frontliners and the general public? How do we sustain jobs during and after COVID-19? And how do we help our stranded citizens in other areas? Because this is actually an issue that many provinces face to this date. Next is how do we ease into getting back to work? And for the whole country, and I know every single LGU official that we have nationwide. This is probably the first type of this type of calamity that we've experienced, diba? And this has been very, very difficult for everyone. This is all new. We don't know how. It was so very difficult to adjust, and that's why it is very important that we make critical decisions in this time of calamity. So nextly, I wanna explain, our division and coordination of tasks before I get into what it is or the real situation here in the ground. What we experience here in the province. So first is the executive department. Mainly, as you've all have seen, they're the ones fully implementing and directing the fight against COVID-19. And our job in the legislative department is to legislate and appropriate the funds. And as we have done with the Bayanihan Gilas 1 Act, and till today, we're still implementing, the funds, the social amelioration program for the millions of beneficiaries around the country. And then, that it's very difficult for us in the legislative also that even though, our main duty is to really legislate appropriate funds, especially for this fight against COVID. But of course, can't help but many of our constituents still look up to us to really help them in this time of need. And we do, that's why we've, I know many of our colleagues in the legislative department, have given, aid to their displaced constituents throughout the country. They give food rations to wherever needed. They really try to do their best to really accommodate everyone. Although we don't have a calamity fund that we can really use, we're doing our best to really try to accommodate those who are really seeking our help in their time of need. Also, I'd like to describe our local government units, namely our provincial government, our municipalities and cities, and our barangays, and the role of all these three local executives or local executive departments at the local level, the provincial, municipal, and barangay. So our governors, of course, are directing or the directives that they've received from the interagency task force from Malacanang, and how do we implement this effectively on the ground. And goes to show, goes the same for our municipalities and cities, for our mayors. Alam niyo, sobrang hirap po ng desisyon sa bawat munisipyo at city itong time na to. Dahil firstly, everything is on a hold. Walang trabaho, walang income ang mga tao, walang transportation. Ang hirap talaga ng sitwasyon dahil nga essentially you're trying to stop the movement of the virus by essentially stopping the movement of people and isolating those who are infected and those who are on high risk of being infected. Luckily, in the province, one of the advantages of being in the province or in the rural province is that most of the places here are much more isolated. Mas hiwa-hiwalay kami dito. One barangay to the next might be a few minutes away. So we have a lot of space apart, and that I think that's one advantage that we can have. And then if just so the time or just in case it happens, we can really isolate certain areas and really look after a certain community if needed. Diba? Hindi parang sa Manila, alam ko po sa NCR napakahirap ng sitwasyon dahil nga na, of course, it's much more congested. The population is, there's a lot more people in Metro Manila, and there are a lot more people who need help. So, these are some of the challenges or some of the many challenges that our local officials, mainly our mayors and barangay officials face. Again, I'd like to go, sorry, I'm going a little bit off track. Gusto kong bumalik sa barangay level. Alam nyo, pagdating naman sa barangay, sila talaga yung gumagawa ng legwork para po sa ating pamahalaang lokal. taga-implement po sila ng lahat ng programs. At usually, at this time, I know that this is the case for every single municipality and city in the country, that the barangays are who we resort to kung gusto natin mag-distribute ng mga relief assistance natin, itong social amelioration program natin. Everything that's done on the ground is done through our barangays, our barangay officials. So all of them are actually are considered our frontliners in this fight against COVID-19. Yung ating mga barangay tanod na nasa checkpoints natin 24/7, mga barangay health workers natin who are checking up on our communities, who are making sure yun nga that dumadating yung tamang tulong sa ating mga kababayan, yung initial checking na kung talagang if you have symptoms or similar symptoms to what a COVID patient might experience. So napakalaki po talaga, gusto ko lang sabihin talaga, napakalaki ng sakripisyo ng ating mga barangay officials dito po sa ating fight against COVID-19, as they are also one of our main frontliners. And of course, to all the rest of our frontliners, our medical team, all the nurses, all the doctors, all the ambulance drivers, I'd even consider those truck drivers, yung mga nagka-cargo po natin, lahat ng mga nagdadala ng goods from province to province, from town to town. I'd consider them some of our frontliners that sila po talaga, again, ang ating mga hero dito po sa ating fight against COVID-19. And really like to stress the importance on the role that they play in making sure that we are all okay, making sure that the barangays, all our yung mga kababayan natin, okay lahat sila, nabibigyan sila ng tamang tulong. So, for the most part, ito po ang kanilang mga kanya-kanyang roles. Nextly, I'd like to get into the real situation in the ground. So, I think nung na-implement nga po itong enhanced community quarantine, a lot of us or most Filipino families are asking this question: how do I survive and what do I do in this time of COVID-19? So, ang talagang tinitingnan po natin dito ay yung survival of Filipino families, because the decisions that we make, as local leaders, especially to our LGU leaders, the decisions that they make, our executive department, our president, the decisions that they make really impact all of us. And if they make wrong decisions, it can literally translate to losing thousands, if not hundreds of thousands of lives if we make a mistake. So ganyan po kabigat yung sitwasyon ng hinaharap ng bawat pamahalaang lokal. And yun nga, nabanggit ko po kanina, na walang trabaho ang mga tao, wala pong cut-off lahat ng transportation, walang income. Kaya dapat nating bigyan ng pansin ito, at dapat tayo sa pamahalaan, kami po sa pamahalaan, kami po yung magpo-provide nitong mga ganitong bagay. Gusto ko lang po magbigay ng example rin for example, the municipality of Itiague, we have about 70,000 people living in our municipality. Of course, in addition po, marami pang mga ibang nandito na yung mga taga-ibang probinsya na mga naninirahan na po dito or nagtatrabaho po dito or naghahanap buhay po dito. So we have to include all of these people in the people that we have to take care of in the time of COVID-19. No, dapat wala na po tayong pinipili. At wala na po talaga tayong pinipili dito. And I can say the same for most, if not all, LGUs. Talagang tinutulungan po nila, sinusubukan nilang tulungan lahat ng sinasakupan nila. Kung sino man yun, hindi man taga doon po sa kanilang bayan or barangay, binibigyan po nila ito ng tulong. So ang amin pong, for example, ang aming ginagawa sa bayan ng Itiague, on a weekly basis, nagbibigay po ng 3 kilos na bigas sa bawat tao sa buong bayan, na talagang lahat po, may bata man, matanda, taga dito, hindi taga dito, ay binibigyan po ng parang rice subsidy or rice ration ang ating pong mga kababayan. And this has still been going on. This is still ongoing at the moment, even though GCQ na po kami. Pero alam ko pong napakahirap ng sitwasyon, dahil alam nyo na dumadating po tayo, or we have heard of other instances, di ba? nako-compare natin, sinasabi natin, sa ibang bayan, gintong binigay sa amin, may mga karagdagang ibang ulam or may canned goods, or may ganitong bagay. Gusto ko lang po, again, to stress that every LGU po have different capacities, capabilities po in time of calamities. And just to inform everyone po that meron po kasi tayong calamity fund lang na pwede gamitin as an LGU. At the barangay level, at the provincial level, at the municipal level, even at the executive, at sa national level, meron lang po tayong 5% na calamity fund out of our whole entire budget na pwede po natin gamitin para nga po tugunan itong mga problemang ito pang relief. So if you had 100 million, you can only use 5 million for this, for providing relief. And if you have 80,000 people, 5 million really is not enough. Kaya nga po buti na lang po ang ating Department of Interior and Local Government ay talagang inallow nila yung mga LGUs na magbigay or na i-realign po yung mga budgets nila at gamitin yung development fund or iba pang pondo para nga po magamit natin against sa COVID-19. Makapag-provide po tayo ng tamang assistance sa ating pong mga kababayan. And so these are one of really the main challenges from the ground up all the way to the national level is our limited resources and funds. Nakita naman po natin na that I can honestly say that, genuinely say that most, if not all again, all local leaders, kung kaya lang po nilang bigyan ng tulong talaga every single person ng pantay-pantay, gagawin po nila yan. Pero kahit ba man ganun, hindi po kasi yun ang realidad na limited po talaga ang ating resources na pwedeng ibigay po na tulong sa ating mga kababayan. That's why this really is very critical in how we plan for these things, especially in times of calamity or national emergency. Also, one of the main challenges that we've had is moving goods, services, and people. Alam niyo po na, of course, ayaw niyong i-risk yung safety ng ating mga kababayan sa bawat barangay, sa bawat bayan. So we really have to limit the movement of people. Hanggang ngayon, napakalaking problema nga po yan dahil hindi po namin alam kung paano namin lahat papauwiin ang aming mga kababayan na nasa ibang probinsya na. Dahil nga syempre pag they really pose a risk if they're gonna come home. Kaya po ito po yung talagang isa sa mga issues na talagang dapat itackle na po or tinatackle na po ngayon ng lahat po ng mga LGU, sa amin po sa national, sa legislative, at siyempre sa executive department po natin. And ultimately, our goal for every single family is really to protect your home, to put your health and safety at the top priority. And it goes the same for every mayor, every barangay captain, every governor, na talagang ang pinapangalagaan po nilang unang-una ay yung kapakanan po ng kanilang locality, yung kanilang bahay. Diba? Kung ako po ay mayor, yung aking pong bayan ang talagang unang priority ko na gusto ko po safe na safe ang aking mga kabayan, nabibigyan ko sila ng tulong. At yun nga po na talagang the risk that I'm willing to take, syempre I'm trying to minimize that. Kasi kung kumalat po itong COVID-19 sa amin, ay malaki po yung repercussions po nung ganitong bagay. And again, I'd like to stress yung ating pong decision making. And earlier, I've touched up on how important is yung decision making kasi nga a wrong decision can literally cause thousands, if not tens of thousands of lives. For example, hindi po natin kaagad ni-lockdown yung NCR, yung Luzon, nung ni-lockdown natin. If na-late tayo by a few weeks, it could have escalated the situation and talagang it could have been exponential kung ano po yung naging infection rate sa ating mga syudad, sa ating mga probinsya. Siguro mas dumami pa ito kung hindi po natin kaagad ni-lockdown ng ating pong mga iba't ibang areas. And also on the local side, the local decision making, it's one of the challenges also is how long do we prepare for? Kanina nabanggit ko po na limited lang po yung ating funds. Ngayon, ang national government din natin, limited na ating funds. So how long can we prepare for and how long do we endure just the fight against, or how long can we endure this fight against COVID-19? Like for any mayor, kung bibigay na po kagad niya or i-distribute na po kagad niya lahat ng funds or pondo niya sa isang buwan, para po yung buong pondo niya na or lahat po ng pwede niyang gamitin sa isang buwan para lang, syempre mas marami pong maibibigay sa mga tao. Pero kung hindi po tama ang kanyang calculation kung gaano po katagal magtatagal itong or itong national emergency po natin, it can really be a disaster for our municipal mayors. Kaya nga po talagang very difficult po ang decision making, talagang very critical po ang decision making sa bawat isa ito pong panahon ito. Kaya many are really trying to see and calculate and really think about their decisions before they make it. Kaya mahirap po kasing magkamali talaga sa ngayong panahon na ito. Kaya they have to be quick and calculated because yun nga, ang bilis din kumalat po nitong disease po na ito. And one of the issues that we also have, of course, is how do we balance public health and the economy? Again, it goes to the question we had earlier, yung on a national scale, how long can we prepare or endure something like this? Di ba po na ang ekonomiya natin ay talagang siyempre badly hurt. Ang mga negosyo natin, ng ating mga kasama, ng ating mga kababayan, kahit yung mga lalaking kumpanya, talagang affected po lahat. And many are at the risk of, to be frank, many are at the risk of closure. And many industries also will be paralyzed for the next few months, for the next short while. Talagang hindi po agad makakabangon basta kasi our transportation nga, our movement of goods and services are all very limited at the moment. Kaya po napakahirap po ng sitwasyon nito. That's why for every official, balancing public health in the economy and how do you figure out this fine line of not letting the country and the economy sink, at the same time protecting our people, protecting the Filipino people, and protecting every single life that we have here in the country. So yun po ang isa sa mga napakahirap na desisyon na hinaharap po ng lahat, ng marami ngayong panahon na ito. Also, I'd like to stress also ito pong who benefits sa mga. Again, kanina nabanggit ko nga po, kung pwede lang talagang bigyan ng tulong, kung ano yung social amelioration program, kung pwede lang po bigyan talaga lahat ng tulong, ay gagawin po natin ito. Subalit, kulang po ang ating funds na kayang i-allocate dito dahil nga ang dami nating pang ibang problema, ang dami nating kailangan i-revive sa ating ekonomiya. So, ito po ay napakahirap na desisyon para po sa lahat. At the barangay level, at the municipal level, at the national level. This is probably one of the hardest questions. It's who will get help, paano po natin the amount, everything that that you can think of, all these factors that you really have to think of while making all these critical decisions. Because again, a wrong mistake or a wrong decision can really cause lives. So yun to po ang realidad po ng bawat or ng ating pong government ngayon. And also, on a national scale, I know many are wondering kailan ba tayo matatanggal sa ECQ or kailan ba tayo malilift sa ECQ, kailan ba magiging GCQ or GCQ to, going back into normalcy. Kami po sa aming lalawigan ng Isabela, we are actually happy to report. I'm actually happy to report to everyone who's participating now that we have 0 cases at the moment. Nakapag-recover na po ang aming mga cases or confirmed cases ng COVID-19 dito po sa aming lalawigan. Subalit meron pa kaming 87 suspected cases. Some are awaiting their test results. They're in hospitals. Some may mga symptoms, may sakit. And unfortunately, meron pong isang namatay po na pasyente dahil nga po sa COVID-19. Subalit ganun, alam nyo, nung na-lift po ang aming enhanced community quarantine, for many or for the public, actually, syempre masaya pong lahat dahil kahit papaano mas nakaluwag ng konti ito pong GCQ, yung ating General Community Quarantine. So balik ganun, sa amin naman po sa local government or sa amin pong distrito, sa mga mayors, napakahirap po ng sitwasyon nito dahil mas naging relax. You gave that sense of relaxation po sa ating mga kababayan na okay na umalis, makipaghalubilo sa mga kapitbahay, yung mga ganitong bagay. So also medyo nakakatakot din kasi syempre hindi mo maalis yung fear na pag may pumasok or may na-infect na naman sa amin or dumami yung infect na cases ay bigla po itong magsispread kaagad kung hindi po careful or hindi cautious ang ating mga kababayan dito. Kaya po ito is one of the hardest decisions for our executive department, whether or not to lift certain areas from ECQ and GCQ. Ito po talaga ay napakahirap na desisyon, lalong-lalo na po I can say for Metro Manila. Dahil nga, alam naman natin, mas yung flow of people, the flow of everything in Metro Manila is a lot quicker. Yung pace po dyan mas mabilis, mas malapit ang areas po natin. So the risk of being infected or spreading this infection in other places is a lot quicker in these more congested places. Kaya po napakahirap po na sitwasyon nito. Also, alam niyo po, dito sa probinsya, kahit wala na po kaming case, ay kami very strict pa rin po sa aming movement ng mga individual dito sa amin. Dahil po, isa na dito kung bakit very strict kami, talagang kinakatakutan namin na kumalat itong COVID-19 po dito sa amin, ay dahil first of all, yung aming capacity po dito ng health facilities po namin dito sa aming lalawigan ng Isabela. You know, we are a rural province and we only have, kung tutuusin, kung kakailanganin po ng mga ventilator ang ating pong, or to maging severe yung symptoms ng ating mga patients under COVID-19, hanggang 100 lang po na patient ang kaya po namin i-accommodate na mga ventilators. Kasi hindi po, we don't. Hello? Hello?
Yeah.
Sorry, I got disconnected. The internet isn't as good here in the province. So, pasensya na po. Saglit lamang. Can everyone still see me? Just to make sure.
Yes.
Okay.
Yes,
let me
we can see you.
My screen. All right. I think I was here, the critical decision making. So again, yun po yung situation po namin, yung health capacity or capacity ng health facilities po namin dito sa aming lalawigan. Hindi talaga namin kaya accommodate kung sakaling dumami yung aming mga patients. So again, I'd like to make a bit of compare and contrast dito po sa ating mga rural versus or sa rural areas versus urban. Alam nyo, again, kanina nabanggit ko na kanina na mas essentially it's easier to manage the flow of people dito po sa rural areas kasi nga there's more distance from every municipality, from every barangay. Mas isolated po kahit papaano ang bawat bahay, bawat barangay, bawat munisipyo po dito sa amin. Again, I've touched on the capacity and capability of our health facilities per LGU. And also, this is very important. I'd like to explain the cost of COVID. I know marami po sa atin or commonly marami sa atin talagang siyempre sabik na pong lumabas ng bahay, sabik na pong trabaho or kung anumang bagay. Pero kailangan po nating isipin din yung cost of COVID. When I say cost of COVID, dahil we want to get back into work, we want to get back into our business or all these things. Pero pag sakaling nahawa po tayo or na-infect po tayo ito pong sakit na ito, nakita naman po natin kung hindi public hospital, kung sa private hospital po tayo pupunta, ang pinakamura na pong cost po sa atin ito ay about 1 million pesos. Yan na po ang pinaka-minimum po nito. Dahil every use or every painom sa iyo ng gamot ng mga doktor, ng mga nurse, kailangan nila magsuot ng panibagong mga PPE, kailangan nila mga bagong gamit, ng bagong gloves, ng bagong face mask, all of these things. And in a day, kung bibigyan ka ng gamot 3 times a day, so 3 beses, you pay for all of these costs that are required para nga to take care of you. And yun nga po yung nakakatakot dito because our public health facilities, our public hospitals cannot, sakaling talagang maraming na-infect, hindi po talaga kakayanin ng ating mga public hospitals ito. So we really have to think about the cost of COVID. That's why everyone has always been stressing that, if it's not necessary to go outside, if it's not necessary to go elsewhere, if it's not necessary to work, or if you can work from home, do so and do not. And if you do go out, if you do happen to go out, of course, we want to go back to that some sense of normalcy. Gusto naman po natin, as long as you remember to be, protected, yun nga po, mag-ingat po tayo, maghugas ng proper hygiene, all these things that all of you already know. So yeah, yun po yung cost of COVID. Again, I'd also like to get into naman yung amount of resources. Kanina po, I've already touched on that, na imagine yun lang po, like, sa QC, for example, just giving an example, if you have 2 to 3 million people and providing aid financially, through relief, through food rations, through medical assistance, through all these things, napakahirap po niyan para sa mga lokal na pamahalaan po ng mga ganito po kalalaking syudad. So we really have to adjust our expectations also with our, with the classifications and of our localities. Kaya para lang po kasi talagang nakikita mo po sa social media, kino-compare palagi. Yun po nakakalungkot, kino-compare palagi. Iba't ibang mga city, iba't ibang mga munisipyo, bakit daw sila nakatanggap ng ganito sa iba. So different planning, pero rest assured, all our local leaders are really trying to do their best to really, manage this crisis. So rest assured po yun. Also, some of the best practice we've had here in the province is we've incorporated, rolling stores, yung mga pupunta po dun sa iba't ibang barangay para sila po nagtitinda na ng mga palengke or mga goods sa bawat barangay para malimitahan na rin po yung labas ng mga tao, yung pagbigay po ng mga ECQ or GCQ passes. Dito po sa aming bayan ng Itiague, per family or per household, isang pass lang po ang pwedeng ibigay. At dun po sa isang pass na yon ay isang araw nyo lang po pwede gamitin yung pass po na yun. Isang tao lang ang pwedeng makalabas. And it's really just to buy your basic necessities and goods. So talagang it really limits yung movement po ng mga tao. So yun po ang aming ginagawa or ng isang ginagawa ng isa sa mga munisipyo po dito. Yung isa nga ay yung rolling stores. Yung iba naman po ang ginagawa sa munisipyo rin ng Itiague, ginagawa po nila nung ECQ pa, ay yung mga barangay officials ang bumibili sa palengke ng lahat ng kailangan ng kanilang mga kabaranggayan. Alam kong it's impossible for Metro Manila, but in the provinces, it's something that's doable. If you have a barangay of 400, 500 people, yung mga naka-assign lang po na kagawad, mga barangay officials sa bawat purok, at sila lang po yung naglilista ng mga bibilin ng kanilang mga kapitbahay, nagbibigay na lang po ng pera yung kanilang mga kapitbahay at nag-aambag na lang po para dun sa panggas or para dun sa babayaran arkilahin na sasakyan or truck o anumang bagay. And of course, ultimately dito po ang ginagawa namin ay transparent po kami sa lahat. Most of our mayors here have been very transparent online. Lahat po ng mga nakakatanggap, for example, ng social amelioration program, dinidikit po nila sa kanilang mga barangay. Yung mga iba't ibang food rations, food relief, nililista po nila, pinupost nila sa kanilang mga barangay, sa bawat, even yung mga bahay, yung mga beneficiaries po sa bahay, ang aming pong yung mga tao po dito ay nililista rin po nila kung sino po yung mga makakatanggap at kung sino lang po dapat yung makatanggap. At very honest naman po yung mga aming mga kabayan, which we are very, very thankful for. You know, and one thing that we want to touch on is the bayanihan spirit. Alam mo, talaga nakakatuwa dahil ang dami nating instances na kung wari yung sa amin dito nga sa Etiague, nagbibigay ng bigas sa isang pamilya, for example, talagang marami po sa kanila, i-wini-wave na po yun nila yung kanilang ration or food ration. At binibigay po nila willingly sa iba't ibang mga kababayan nila, sa ibang kabarangay nila. Dahil alam nilang mas marami po nangangailangan. Ganun din po yung social amelioration program. Marami po kaming instances dito po sa aming lalawigan, narinig namin na yung natanggap po nilang pera ay sinishare po nila sa kanilang mga iba't ibang pamilya o kung sino man yung nakatira pa sa bahay po nila. Kasi marami po sa amin dito, in one household, under one roof, sometimes there are 3 to 4 families living in one roof, if not more. So, yun po, sila naghahati-hati na po sila kung di po talaga sapat yung fund or yung dami na nakakatanggap. Kasi nga po, limited lang po talaga yung mabibigyan nito. And also, ang dami po, alam nyo, since nag-start po yung enhanced community quarantine ay ang daming, lahat ng checkpoints, lahat ng hospitals, halos lahat ng frontliners, ay halos lahat talagang binibigyan po, nagpapadala ng pagkain po lahat ng ating mga kababayan. Whether they be from a government office, public office, private office, or talagang sarili lang po nilang at their own willingness to help out. Talagang may mga kapitbahay na nagpapadala sa barangay, nagpapadala ng merienda, pagkain, ng tulong. Talagang nakakatuwa po at nakakataba ng puso na ganito pong bagay ang nangyayari po sa ating mga neighborhoods dito sa aming lalawigan ng Isabela. At alam kong ganun din po ay maraming instances na ganitong nangyayari sa iba't ibang parte ng ating bansa. So again, I'd like to touch on what we can, I guess, how we manage our crisis. Of course, alam niyo po, hindi namin magagawa, or ang aming mga mayors, ang aming governor, or kung sino man, ay hindi nila magagawang i-contain, i-manage, or maging successful dito sa laban against COVID-19 kung hindi po dahil sa kooperasyon and suporta ng lahat po ng mga stakeholders. And I mean, lahat po ng the general public na hindi po lumalabas ng bahay, na sumusunod na magsuot ng mask kada sila ay nasa labas, sumusunod sa curfew, hindi nagpapasawa, yung the cooperation ng lahat ng stakeholders natin from literally from all departments, from all organizations, whether public or private. Ito po ay talagang nakakatuwa, and hindi po magiging successful, hindi po maimamanage ito kung walang cooperation and support ng bawat isa po. At I think yun po ang success ng I think that equates to success for any given situation. Again, our coordinated efforts between our LGUs, our districts, the provincial government, and the commitment, of course, of our frontliners, and vice versa, the LGU's commitment to our frontliners to provide for them, to help them, to really give them extra on what we can. Pero yun nga po, hanggat sa makakaya naman po namin, ginagawa po namin ang lahat para tugunan po ang lahat ng ito. And again, effective decision-making, the bayanihan spirit, as I mentioned earlier. And lastly, I would allude to luck, na hindi po talagang maraming cases yung pumasok dito sa amin na nanggaling sa iba't ibang probinsya man, or hindi po talaga kumalat, or anumang crisis. Every time we have a crisis, we always prepare for the worst. We're in liquor ban, nagkakaroon po kami ng curfew dito po sa aming lalawigan, all these things. And mainly, part of it also is luck, na hindi ka tatamaan ng bagyo, hindi ka tatamaan ng ganitong bagay, o hindi dumadami yung cases mo. So we can only do so much also in this time. So last slide. So how do we move forward and what do we expect in this time? Of course, this is going to be a big adjustment for everyone, and we all have to accept that this is the new normal. You know that for some time or for a certain time, that this is the new normal. That we all have to go out wearing public or wearing face masks. We all have to observe social distancing and all others that involves this new normal. And it's important that we adjust with it na. May it be businesses. The sooner that I know many have said this, but the sooner we really adjust and we really accept this new normal is the sooner we can really come out of this negative parang also from COVID-19. And again, from our government, our Balik Probinsya, Balik Pag-asa program. And I really hope that we invest more in agriculture and food security, because it's something that was a concern at the peak, or I mean, still when it started pala. Sorry for that. I didn't mean the peak. I meant the start of enhanced community quarantine. The food security was really a big issue. Income generation, protecting our local industries, of course, and providing jobs for our people. And of course, we have to prepare also, and we have to be cautious and aware of the possibility of a second wave of COVID-19 if we're not careful. So everyone has to do their part, and we all know this. And lastly, it's something to ponder on, is how do we recalibrate our economy into something that's productive and efficient after or during this time of COVID-19. If we can invest more in agriculture, maybe all the OFWs that we have now, all that human capital that we have today, we can find opportunities for industries for them. All these things that we can play around with, or we can think of. And how do we really come out stronger and better out of this crisis? Again, thank you for listening. If anyone has questions, I'm sorry if it took longer than expected, but thank you again for everyone. And I really hope that everyone stays safe, stays healthy, and you stay hopeful that things get better. And I really hope and pray that you guys are all safe from this pandemic. So yeah. Thank you very much, everyone. Thank you, Arthaland.
Yeah, thank you, Congressman. So this is the Q&A portion of the